As RSV continues to spread across the triad, one big warning sign doctors say to watch out for is called belly breathing.
Yeah, and you might be wondering, okay, what in the world is that? It sounds a little strange. One mom took a video of her baby who had RSV so that you can see it for yourself.
You could look at the rib cage and you could see his skin like pulling in as he breathed. They say that's a major sign.
I want to loop this video over and over again so you can really get a good look at it. The chest goes down and the belly goes up. Whenever the child tries to breathe in, it's the same process. Mom said it was obvious enough that she knew something was wrong.
Just a look in his eyes. I know my baby, he's a happy baby. He rarely cries, but I could tell he was in pain. And just to really keep an eye on him when they're sick. If you have any second thoughts at all, go straight to the emergency room. The worst they can do is send you away.
Well, we've all come to know COVID as the threat, right? Every fall, every winter, we know that we need to also ready for the flu. And now doctors say we need to be looking out for RSV.
Another one. With all three circulating at the same time, health officials warn we could see a tripledemic this virus season. It's the last thing people want to hear after 2 years into a pandemic. Let's take a closer look at how serious this possible risk is.
The season is already off to a rough start, with respiratory illnesses spiking around the country. Experts are concerned about a possible tripledemic.
We have 3 respiratory viruses, RSV, influenza, and COVID, rising at the same time. Obviously, that's something we're going to monitor very closely.
Pediatric hospitals in many states are at capacity, with kids fighting respiratory infections. But White House COVID-19 response coordinator Dr. Ashish Jha says Americans are not powerless in this situation. Getting vaccinated can make a big difference.
We have flu shots that keep people out of the hospital. We have COVID shots. We have a brand new COVID shot that is formulated against the virus that's out there right now. That will keep people out of the hospital, prevent people from getting seriously ill.
Dr. Jha stresses that keeping people out of the hospital is critical when so many viruses are circulating, so hospitals do not get overwhelmed. Taking common sense precautions such as staying home when sick and washing hands can also help keep everyone healthy.
Unlike the COVID and flu, there is no RSV vaccine that is available. Several companies are trying to develop one. Like that health official just said, we have highly effective shots for the flu and COVID. This remains one of the best ways to protect yourself from each virus and avoid a tripledemic. Now, we spoke with an infectious disease expert from Cone Health earlier this week, and she shared more ways to avoid it.
I think the same principles that we've been using over the last couple of years includes hand hygiene, coughing etiquette, try not to cough in your hand and then shake someone else's hand, and also and masking, obviously. So I think all those are very useful tools to preventing the spread of respiratory viruses. And especially if you're traveling, I feel that also wearing a mask on the plane is very useful and protective of the patient.
And she says if you are traveling, choose a high quality mask like an N95. It's your best option.